All right, team, I'm going to show you what we were showing you in the ultrasound. So skin, top of the breast up here, little bit of fatty tissue, your breast gland tissue there. Here's the muscle we talk about. So if it's half under the muscle, it'd be under parts of this pectoralis muscle. Here's the fatty tissue. There's the little white line right here. This is the fascia of the muscle, that really strong layer. So when we put our Tumescent solution, it was basically expanding this space here. So right under the gland, above the muscle, and that spot. You've seen us talk a lot about this for our fat transfers. And so next what we're going to do is use our introducer. Introducer is going to come into that space right perfectly, which we've already expanded with that Tumescent, right? It went from a little space to a much bigger space because of that fluid. So if I show you this in a different direction, right? Coming in from the inside, getting right underneath that. The cool thing is you don't have to be right behind the nipple. We can give people the functional fullness where they want. Once we've created that space and we've made that tunnel, we can take our balloon in and then we can fill this up to just create that space. What that's going to do is protect all the ligaments here. It's going to give us that natural internal bra. We can still do little belt and suspenders and suspend that or help that with some internal bra, which we're going to do today. But really, really cool to be able to support that implant exactly where we want it in a perfect spot and really give her that nice functional fullness. So I'm going to show you all of that in just a second. All right, Jim, this is cool. So we've got our nice custom cleavage, a lot of functional fullness. I'll do a tiny little baby incision here.